Today on Nursing Matters, the NCLEX is changing and what every nursing student needs to know. I'm Christina, and this is your daily dose. Let's get into it. Because if you're a nursing student right now, or you love someone who is, there's a quiet shift happening, and it's a big one. The test you're preparing for is not the same test your instructors took. It's not even the same test nurses were taking just a few years ago. And that matters because I'm seeing a gap right now between how students are being taught and how they're being tested. And if you don't understand that difference, you can study really hard, do everything right, and still feel completely thrown off on exam day. So today, we're going to break down what's actually changed, what the test is really measuring now, and how to prepare in a way that actually works. The Next Generation NCLEX, or NGN, has now been in place for 2 full years. And after an initial dip, pass rates have stabilized. Right now, the national first attempt pass rate for U.S. educated candidates is sitting at around 87%. So on the surface, you might look at that and think, okay, things are fine. But here's what that number doesn't tell you: how different that test actually is. Because the NGN didn't just tweak a few questions. It fundamentally changed what is being measured. And here's where I'm going to be very direct. Most nursing faculty did not take this version of the exam. They took a version that prioritized knowledge recall, pattern recognition, and test-taking strategy. Not clinical judgment at this level. So we have a situation where students are being taught by people who are incredibly knowledgeable, but who didn't personally experience this testing format. And that gap, it shows up in preparation because students are still being trained heavily on memorization, standalone questions, and pick the right answer thinking. When the test has moved into something much more complex. And if you don't adjust your preparation to match that shift, you're studying for the wrong exam. ACLS certification is essential for healthcare professionals who need to be prepared for life-threatening emergencies. However, finding the time to attend in-person training can be a challenge. That's why ACLS.com offers a fully online ACLS certification course, allowing medical professionals to earn their credentials without disrupting their busy schedules. To learn more and enroll today, visit acls.rnnet.org. That's acls.rnnet.org. If this episode feels like something you needed to hear, go ahead and like and subscribe. And if you want more support as you figure out your next step, visit rnnet.org. That's rnnet.org. Let's continue. So the Next Generation NCLEX doesn't just ask what you know. It asks how you think. And that is a completely different skill set. The old exam could be approached like this. Do I recognize this content? Can I eliminate the wrong answers? And can I pick the best option? The new exam, totally different, and it's asking, can you interpret this situation? Can you prioritize what matters most? And can you decide what to do when the answer isn't obvious? And that's where a lot of students get stuck because they're used to certainty. They're used to right answer versus wrong answer, finding clear patterns and predictable formats. But clinical judgment is not always clean. Sometimes the correct answer is continue monitoring, and that feels uncomfortable because it feels like you're not doing enough. But in reality, that is exactly what a strong nurse does in certain situations. They don't overreact. They don't jump to intervention without data. They assess, they observe, and they think. And that's what the exam is measuring now. Your ability to sit in that space, to tolerate ambiguity, to think through a scenario on a step-by-step basis. Now let's talk about the case study format, because this is where the biggest shift happens. Instead of one isolated question, you're given a patient scenario that evolves. You get background information, clinical updates, lab results, and changes in condition. And you're asked to make decisions across multiple points. So this is not about guessing. It's about building a mental model of the patient, tracking what's happening, and adjusting your thinking as new information comes in, which, if you think about it, is exactly what real nursing looks like. So in many ways, this test is actually more aligned with real practice, but only if you prepare for it correctly. Because if you're only practicing flashcards, standalone questions, and memorization drills, you're missing the core skill. And here's the hard truth. You can know the content and still struggle with the exam if you don't know how to apply it in its context. That's the shift from knowing to thinking. So here's the one thing I want you to do starting now. If you're preparing for NCLEX or you know someone who is, shift your practice. Prioritize case-based questions, not just standalone questions. Case studies. Because the format itself is part of the challenge. And the more familiar you are with that format, the less it becomes a variable on test day. There are platforms that already offer this, such as UWorld and Nurse Archive. They have NGN-specific question banks. Use them. And when you practice, slow down. Don't just ask, did I get it right? Ask, how did I think through this? Because that's what you're training for. Your thinking, your prioritization, your clinical judgment. And over time, something shifts. The questions start to feel less overwhelming. The scenarios start to feel a little more familiar. And your confidence starts to come from understanding, not memorization. And that's exactly where you want to be. So if you take nothing else from today, take this. The NCLEX didn't just change the questions, it changed the skill. And if you adjust your preparation to match that, you'll be ready. Not just to pass the exam, but to step into real-world nursing with confidence. This is Nursing Matters, and this is how you prepare for what's actually in front of you. If this episode helped you, send it to a nursing student who's getting ready to take the test, because this is the kind of shift that can change outcomes. I'm Christina, and I'll talk to you tomorrow. Thank you for listening to this week's episode of Nursing Matters Daily Dose. Are you interested in more career resources? Then hop on over to the RN Network at rnnet.org. Also, while you're at it, hit that like and subscribe button and share this episode with one nurse who really needs to hear it. Thanks so much, and we'll see you next time.